Shelters are more than temporary accommodations. They are essential services. They connect people to vital services that are otherwise out of reach, including healthcare. Today, in Canada, most shelters are failing to serve people who use drugs, who are overrepresented among people who are experiencing homelessness and grappling with Canada's toxic drug crisis.
We wrote the Shelter Right Report because we noticed a critical gap in the shelters that were accessible to people who use drugs in Canada. Canada is in the midst of an unprecedented drug toxicity crisis, which has already taken tens of thousands of lives. At the same time, everyday homelessness is increasing. People are homeless for longer and in harsher conditions. There's a dire need for shelters to be accessible to people who use drugs, yet most of them aren't.
From 2024 to 2025, the HIV Legal Network met with low-barrier shelters across Canada, speaking with frontline staff, directors, and people with lived experience from emergency shelters, homeless shelters, and transition houses to understand how these organizations work to promote the rights and health of people who use drugs. Shelter Right documents those conversations and research findings. It represents an urgent call to all levels of government to reimagine shelter access for people who use drugs in Canada, to finally meet their needs and protect their rights.
Housing is a human right, and housing is the stability and the base and the foundation for society as a whole. There's challenges from the systemic level, things like affordability, the lack of stock, down to the daily difficulties, which could be things like transportation barriers, access to shelter, survival mode of people who are in crisis. So I'd say it's a combination of systemic barriers and individual factors at the front line that make it very difficult for clients to access services.
There is still so much stigma around people who use drugs, in large part because behaviors related to drug use continue to be criminalized. So people who use drugs are portrayed as inherently dangerous or inherently untrustworthy. And that stigma is reflected in a lot of shelter culture and the staff that work there. So people will sometimes just avoid going to shelters because they don't want to face that kind of stigma. A lot of shelters in Canada just have zero tolerance policies. So you can't access a shelter if you are currently using or if you have any drugs on you. There are also a number of really strict rules that make it hard for someone who does use drugs to follow. So a lot of shelters have very strict curfews, and cravings don't follow timelines. So those kinds of rules are just impractical for someone who uses drugs. Many shelters are quick to report to the police or to child welfare agencies or even to immigration authorities if they are aware of drug use, even when that drug use is not harmful or the cause of any problems. So that makes people apprehensive about going to shelters because a lot of the time when police are called, when child welfare are called, or immigration authorities are called, it results in more harm for everyone rather than good. The last main issue with shelters not being accessible has to do with the lack of harm reduction, which really varies from jurisdiction to jurisdiction because different jurisdictions have different funding for harm reduction services. So a lot of shelters don't have the additional supports that people who use drugs actually need.
Health risks experienced by people experiencing homelessness can be anything because they don't have access to basic medical care oftentimes. So things that you and I would get taken care of or get caught by regular visits to our family practitioner just go unmissed. Typically, people have a much shorter lifespan too as well if they are chronically experiencing homelessness.
They're exposed to extreme weather. There's a lack of safety, lack of access to clean water, hygiene, sanitation, and it's very hard to access healthcare if you don't have a fixed address. So these barriers are putting people's health and lives at risk. People are ending up in encampments over shelters because even if shelters are technically available, they don't feel accessible, they don't feel right, because if they go to a shelter, they might be judged or they might be punished. Whereas in encampments, at least there's an opportunity to be in a community with people who are also going through the same thing, understanding you. Even though, of course, encampments are not the solution, proper, adequate housing is the solution. With our report, we spoke to low barrier shelter representatives throughout the country, and we asked them, what do they do to ensure that their shelters remain accessible? One of the things that we saw across the board is not barring people simply because they use drugs or because they're holding drugs. Also, not punishing people for using or having drugs, being flexible with people, and actually inviting the people who are using the shelter to co-create the environment in which they will be living. Another aspect that we saw or that came through in our conversations was the integration of healthcare into the shelter. A lot of these low barrier shelters had connections with healthcare providers that would come in like once a week, say, to do STBBI testing, or the shelters had close connections with supervised consumption services. Many of these shelters also had practical harm reduction tools, so things like sterile needles and syringes, naloxone kits, referrals to opioid agonist treatment, and referrals to safer supply. They put a lot of effort into creating a trusting environment for everyone. So that meant hiring people that had lived experience and really valuing those experiences. It also meant hiring people that share harm reduction values. We have to meet people where they are rather than judging them. Also making sure that culturally specific needs or gender specific needs, that there were accommodations to meet those needs as well.
Without harm reduction, it just wouldn't be possible to support the number of women and families that we do. It reduces stigma. It makes people feel heard. It makes people feel respected. It's healthcare. You're entitled to healthcare just like anybody else. And if we can switch the stigma around substance use and have a better understanding just as a population of what addiction is, we would never pick and choose who would be allowed to access housing services based on their medical status.
A lot of people come into shelter still with their own stigma of what it's going to mean to be in shelter. What's it going to look like? What are the staff going to be like? What are the other service users going to be like? And then a lot of times you see sort of an exhale when they get in and they see that, yes, I'm surrounded by people who are here to support me. I'm surrounded by people who are knowledgeable about the resources in the community, people who truly want to see me succeed. And I think that exhale gives them a bit of a moment to get temporarily out of that crisis situation and survival mode to feel that they really are in a stable place to start taking steps forward.
Across Canada, government inaction, lack of resourcing, and stigma have left most shelters failing the people who need them most. But several shelters have already shown that a low-barrier, harm reduction-focused approach is not only possible, it is essential. Governments have a responsibility to shelter right.